Hello. Hi.
Oh, hi, Sarah. Thanks for coming in.
No problem. My pleasure.
Hi,
Hello.
Sarah. Nice to meet you.
Nice to meet you too.
How are you doing?
I'm okay. And you?
Great. We're really happy to have you come in today.
I'm very excited about being here.
So we're just going to ask you a few questions. It'll be about 20 minutes long. And at any point, if you have any questions, you're welcome to ask us.
Thank you for letting me know.
Can you give us some examples of where you've displayed initiative as a counselor?
Of course. So I have actually worked with diverse clients at my practicum agency. And before that as well, I've worked with youth, but diverse youth, so with different cultures, socioeconomic status. And I feel like I have shown initiative, especially in accommodating diversity at my practicum agency. I am actually co-facilitating two groups, and I am the only facilitator that speaks Urdu and Hindi and Punjabi. So, and I spoke to my supervisor about taking the initiative of using that language with clients if they want.
Mm-hmm. Great asset. Mm-hmm.
Mm-hmm. So, on that topic of group work or group counseling, what kind of groups are you prepared to handle?
Well, I have been a part of psychoeducation groups. I've been a part of counseling groups as well. And I guess I would be eager to take on any kinds of group. I have, in my bachelor's, been an intern for group facilitation at a rehabilitation center as well. And I would take notes and do enable facilitation and group process. So I feel like I am familiar with group work, and I feel confident doing group work as well.
Excellent.
So as you already know, it's a pretty busy office. We've got a lot of clients coming in, and I'm just wondering, how would you keep yourself organized, and maybe discuss how you multitask?
Multitasking. So I'm just getting familiar with using online organization tools. I've been using my own binder in which I make sure I put all of my appointments down, but now I'm transitioning to using online organizing tools. So using other tools for support. And on top of that, with multitasking, I'm very passionate about what I do. I love counseling and psychotherapy. So I do also enjoy diversity in my work as well. So I like group work, individual therapy. I like different forms of therapy as well. There's play therapy, art therapy, and then with all my adult clients as well. So I like multitasking. But at the same time, I want to take time to complete my tasks as well. So, which is why I take my time in completing all my jobs.
Okay. So, how would you know when to refer a student or a client to another professional?
Well, I think practicing within my competence is very important. That's the utmost important thing as a counselor, because we have a higher duty of care than other individuals. So when do I know when to refer? When I feel that I need more, when my client needs more help than I can give. Or when there's also times when I have referred when I recognize my need to learn more in certain areas or grow my expertise.
What do you think is the most important characteristic of a counselor?
Well, I feel that every counselor brings their own unique characteristics into their work. But for it has to be compassion. That's the feedback I've gotten from my clients, that they can feel and observe my genuine compassion for their experience.
What is the most appealing aspect of counseling to you? What is the least appealing aspect?
Interesting question. The most appealing would be observing resiliency in my clients and seeing them enhance their wellness and feel better and cope with life better. Nothing gives me more pleasure. I feel like I become a happier person just watching my clients succeed. And the least appealing, I have to ensure that I include self-care, because if I don't, then I do feel that it's very easy to feel compassion fatigue.
Mm-hmm. Okay.
I'm just curious to know what your professional development plan will look like into the future.
Interesting question, because I'm looking into that as well right now. I am graduating from my master's in April. After that, I have to continue getting hours, supervised hours of clinical work, and on top of that, I do have to concentrate on extra professional development as well for my registration as a psychotherapist. What I am looking at is enrolling for specialized CBT workshop for individuals, supporting individuals with trauma. I am also very interested in mindfulness, and I practice that a lot with my clients. So just looking into that as well. So those two things are on top of my list, and at the same time, I'm always reading articles and books, and I think that's necessary in our work.
Can you tell us about any experience or an experience you might have had dealing with an irate client and how you handled that situation?
Sure. It's actually a very recent experience. I had a client who I was actually having the second session with that client, and the client had a panic attack and was very angry, and there was yelling and screaming. How I dealt with that was that I, in that moment, recognized what was happening, and I recognized what the client needed, which was grounding. So I could see that the client needed grounding techniques, and we practiced those, and that helped. But it was very, it is exhausting for the therapist as well. So in that moment, I recognized, and I thought about how I can deal with my emotions about this later, and right now my client needs me. So I was fully present. I repeatedly asked my client, what can I do to help you? What are the things that help in a situation when you're feeling like this?
Good.
So I'm wondering if you could describe for us a major accomplishment you've had in the last year that relates to counseling. Or your experience that would relate to counseling somehow.
Yeah. The one major accomplishment, at my practicum agency, I'm seeing clients, diverse clients, like I said, so all age groups, children, young adults, and seniors as well. At my work, I was working primarily with seniors. I was working as intake information and referral specialist for seniors in just setting up home care and ensuring their needs are met. And there's counseling in that as well that I would do to identify their needs. So I guess my accomplishment as a counselor is the diverse experience that I've gained in the past year with different populations.
Great.
Who in our community would you expect to be a part of the team in dealing with a family that has experienced family problems?
Well, the first point, I guess, of initiating services for families that's dealing with family problems, if there are children involved, would be Family and Children Services. And then after that, it's us, it's therapists. But if I was to really think about it, I think the most important part in a family dealing with family problems is the family itself. Other people are just support people, but it's the family itself.
So you would try and strengthen the family's
Yes.
functioning?
Yes.
Okay. How would you deal with a student, how would you deal with a conflict with a client or another team member?
Conflicts are never fun. How would I deal with it? Well, I'm very respectful, so that's the first thing. I don't appreciate conflicts. They're stressful. And I try and avoid them as much as possible, but there's times when you need to address things for progress and for development, for my own development, for the other person's development as well. I guess the first thing is I'm very careful about the route to take. So should I report to my supervisor? Should I take the first step myself? And that would require problem solving and brainstorming. It's different for different situations. Sometimes it's not my job to correct someone, it's my supervisor. Sometimes it is my job to first give them a warning and let the supervisor do the correction.
How do you gain rapport with your clients? Give me an example of a time when you were able to build good rapport with a client.
The last time where I was dealing with a client that was showing, I would use the word, a little bit of resistance, was when I was working with a youth who had a diagnosis of oppositional defiant disorder and had clearly stated he hates authority. How did I build rapport? I reduced that authority. I had no authority over him. He was there. I'm very client-centered, and I displayed that in my mannerism. There were times when he was silent and I was silent, just to respect his silence, not to control him. And with time, I noticed that he opened up. So that was the most recent example that I had.
Okay, thank you.
I think we're getting close to wrapping things up, but I think we have a couple more questions. I'm wondering what most interests you about this job.
I'm fascinated by people. I'm fascinated by stories. I have a story, everyone else has a story. And I've done a lot of traveling myself. My father was a psychiatrist. My grandfather was a psychiatrist. My stepmother is a psychiatrist. So I come from a family where everyone supports people, is in that field. And I traveled with them as a child, and I observed their work, and I just knew it was for me. Not being a doctor, because I'm not that smart, but working in this field. So here I am.
If we were to hire you at our agency, what do you think the main challenges would be?
I wouldn't like to admit those, but I will, of course, because I like congruence. The main challenges in hiring me, well, I still have to register for the regulating body, which is CRPO, College of Registered Psychotherapists of Ontario. I need 1,000 hours to work independently, 1,000 supervised clinical hours. And for my, I can actually work right away as a psychotherapist, as a qualifying psychotherapist. And for that, I just need 125 hours, and I have those already.
That's encouraging to hear.
Yes.
And so, Sarish, I really appreciate you answering that question like you did, very boldly. Because I wonder if we could just reframe the question a little bit, because we're wondering what you think the main challenges are at our organization here. So I appreciate you answering that question the way you understood it, and we'd just like to ask the question again. What do you think are the main challenges here at this organization?
At this organization, well, I have volunteered for your organization, so I'm very passionate about the work you all do and that I've done as well at this organization. So if I was to think about challenges, I would actually think that you hire a lot of people who work part-time, and I would love a full-time job, but at the same time, I have been working at this agency as a volunteer, so I would love to stay here, and I would take the part-time job.
Okay, thank you so
No
much.
problem.
So I have a question for you. What else would you like us to know about you and your unique qualifications for this job?
Oh, that's a nice question. Well, my unique qualifications. I have a lot of experience working with people with mental health diagnosis because my bachelor's internship, and there were two, they were both done at a psychiatric rehabilitation center. So that's, and right now as well at my practicum agency, most of my clients actually have a mental health diagnosis. So I'm familiar with the DSM-5 diagnosis. I've worked with them, so I'm familiar with the intervention strategies and all of those. So that's a unique characteristic, I would say. But other than that, I speak a few languages, like I said before, Urdu, Hindi, Punjabi. I'm very good with diversity. I am a mother as well of a 6-year-old, so I'm good with children. I've worked with children, so I've worked as a youth worker for many years, so I have that experience as well.
Would you describe yourself as comfortable working with clients with mental health issues?
I do. That's actually one of my strengths that my supervisor at my practicum agency pointed out.
Excellent.
Okay, so and leading into that, you know that we work with clients who have, sometimes have been diagnosed with clinical depression, and sometimes we have clients who are mandated to come to our program. And so I'm just curious to know how you would deal with an unmotivated client.
I've actually worked with unmotivated clients, so from my experience, with mandated clients, there is a set goal that's expected from their counseling, but there's also room for personal goals. And just inviting discussion from the client about their personal goals eases them into counseling, and using our therapeutic alliance. So using compassion and validation and empathy and all of those just to communicate your genuine interest for the client's experience, and then using their personal goals and the mandated goals together.
Okay.
Cool. So a final question that we have for you. We really appreciate your honesty and candor in answering our questions. Can you tell us what might your professional development plan look like?
Professional development, like I said before, I am working towards my registration. I can start working right away as a qualifying member, but I need to continue working towards my registration, so I need to get supervision as well. I want to attend a few workshops about therapies. So all of those together, and also working at this agency, I feel like I will learn so much because I've seen all the therapists and I've seen the work you guys do. So I will learn from all the therapists because there's a lot of teamwork that goes on about case debriefing and case consultations. So I will grow as an individual and as a professional from getting this job.
Okay. Thank you very much.
Thank you.
Thank you. I actually had a question.
Oh, do you have a question?
Yes. So when I applied for the job, there were a few part-time positions and one full-time. If I happen to get the part-time position, is it possible that I ease into a full-time position if there is an availability? Can I apply for the full-time?
Yes.
Excellent. Okay. So if it doesn't happen right now, it'll happen later. Thank you.
Thank you very much.